So thank you all for joining us today to talk a little bit about Medicare benefits. My name's Emily Kile, and I've been an attorney since 1993. So what is that, 30 years? It's been a long time. And I've had my own practice for about 20 or 25 of those years. So I'm really excited today that Cynthia Macluskie has decided to join us and impart to us some great information about Medicare, which seems like it should be super easy to sign up for, and you should just, get enrolled when you reach 65 and be all done. But of course, nothing is that easy. So she's going to help walk us through that process and some things to keep in mind. Cynthia and I have known each other, I feel like, forever and ever and ever. She's been super involved in the autism community, as have I, based on the special needs work that I do. So I try to be not only financially supportive to the community, but provide education and resources for parents and their loved ones. And then she moved into this Medicare space, which has been great because she has already always been working in her entire life dealing with both state and federal government programs. So the complexities that go along with that and Medicare are sort of something that she's always dealt with. So it seems like such a great and natural fit, and she's one of the most caring people I've ever met. So she always goes the extra mile for everybody, which is so heartwarming. So thank you so much, Cynthia, for being here. If anybody has any questions during the presentation, feel free to type them into the chat or the Q&A, and I'll either interrupt Cynthia or we'll get those questions hopefully answered for you at the end. So with that, I'm going to stop talking and Cynthia is going to start talking.
Fantastic. Thank you for having me. I'm so excited. It is my favorite subject. So I'll try to be brief. So feel free to ask questions. So here we go. First, I'm going to tell you a little bit about me. I've been a licensed insurance agent for about 6 years. I've been a Medicaid advocate for over 23 years, and I also passed autism insurance legislation. So when it comes to insurance and federal and state systems, I truly am an expert and love it. Not as much as most people, but that's why I am an expert in it. So I legally have to tell you that I'm not contracted with every carrier on the market, but I am contracted with the majority of them. And there's never any charge for my services. And I just love providing support and education around the subject because it's so often misunderstood. So Medicare is your federal health insurance program. It's designed for people who are 65 or older or who meet other criteria, which we will discuss. And you do have to be a legal US citizen or a legal resident. And when you go on Medicare, it's for you only. You don't do a husband and wife or a family. It's individual health insurance. So the typical way that you're going to qualify for Medicare is you're going to turn 65, have 40 work credits, and qualify on your own work record. However, there's a variety of other ways that this can happen. If you go on SSDI, after 24 months, on the 25th month, you will qualify for Medicare. And sometimes the Medicare card will just show up on your door. You won't even know that it's coming. Other people will join after 65 because they're on group coverage and they keep that group coverage because they're insuring a spouse or a child. If you have end-stage renal disease or ALS, you will automatically qualify for Medicare. And if you're a spouse who, let's say, did not work, immigrated to this country late, you can also qualify for Medicare on your spouse's work record, and there's some intricacies to how that works. So we're going to go over the basics of Medicare before we talk about how you're going to fill in those gaps, because there's a lot of misunderstanding about what Medicare covers and doesn't cover. So Part A, lots of people like to call your hospitalization. I like to call your room and board, because when you're in the hospital, you actually will use Part A and Part B. So Part A covers your room and board for hospitalization, skilled nursing, home health care and hospice. There's usually not costs associated with home health care or hospice, but there are costs associated with your Part A. So generally, for 90% of the people, Part A is premium free. You do have to work 40 work credits or be married to someone who worked 40 work credits, but there are actual deductibles that lots of people don't know about. So when you enter a hospital, your Part A deductible for this year, 2024, is $1,632. It goes up every year. The weird thing about this deductible is it's unlike any deductible you're used to because it resets. And it resets every 60 days that you're out of the hospital. So if you're in the hospital in January and you get out in January and then you're back in the hospital in April, you will see that deductible again. So if you're very unlucky, you could actually hit that 5 times in a year. There's also copays for being in the hospital when you're there for a longer period of time, and those copays will go up every year as well. For this year, it's $408 or $816. Skilled nursing, the first 20 days are 0 copay, but after that, it's $204. And there's something that was waived during COVID that is no longer waived, and that is you must be in the hospital for 72 hours, and it can't be under observation. So you have to be admitted to a hospital to qualify for skilled nursing. Excuse me. And so it's really important if you're in the hospital that you ask, are you under observation or are you admitted to the hospital? They're legally supposed to tell you, but they don't always tell you. And then your Part B, is the standard premium for this year is $174.70, and that covers your doctors, your surgeon, your ER, your radiology, ambulance. So you can see if you're in the hospital, you're going to pay Part A and Part B. Part B deductible is $240, and that is a typical deductible where once you hit it, you're done for the year. But Medicare pays 80% and you pay 20%. And there's no, excuse me, there's no out-of-pocket maximum. So if the bill's $1 million, you're on the hook for 200,000. So that's really important to know because most insurance, we have an out-of-pocket maximum, and that's what we're used to. And with original Medicare, that doesn't exist. The other thing is a doctor who may not like Medicare assignment can ask for an additional 15% of Medicare. Sorry, my dog is naughty. So you could pay not 20%, but 35%. And that's not a small amount, depending on how often you're seeing that doctor. And then there's what Medicare doesn't cover. And surprisingly, it doesn't cover a lot of things that elderly or older people would want covered. So hearing aids, eyeglasses, long-term care, dental vision hearing, your annual physical, believe it or not, is not covered. Medicare covers one annual physical when you enter Medicare and then never again. You can have a wellness visit, but that's different. And it doesn't cover prescription drugs with original Medicare. Also, that $174.70 is the standard premium. If you're a higher earner, you will pay IRMA, which is basically a tax for being a higher earner. And they go back and they look 2 years prior to that year. So for 2024, they're going to look at 2022. And that IRMA applies to each individual. So if a husband and wife are going on Medicare at the same time, you're going to be paying additional monies if you hit that target for IRMA. And you can see that it can be quite expensive. There are some things to know about IRMA, like if you are retiring from a job and applying for Medicare, you can apply to have your IRMA reduced. There's a special application for that. But this is something that most people really don't know about, and it's not talked about, and it can be a shock to the system. Part B premium. So if you're not on Social Security, you will have to pay your Part B premium quarterly, which is not necessarily a small amount. So for 2024, if you have the standard premium, you're going to pay $524.10 quarterly. And the government wants their money up front. So you need to do that. And then you can set up automatic payment after the first time that you've set it up. If you're on Social Security, your Part B premium is going to come right out of your Social Security, and you're not even really going to think about it. So that's important to know, because for planning purposes, you want to make sure that you're going to be able to make that 90-day payment. So then that's your original Medicare. And the reason I bring up original Medicare first is because I always run across one or two people a year who thinks original Medicare pays for everything. And so they signed up for original Medicare and they did not sign up for anything else. And then what happens is I get a call from a daughter or a son whose parent is in the hospital and they're racking up the charges. And it's just so sad because it's just a complete misunderstanding of the system. So you're going to want to pick something to cover those Medicare gaps. And you have two choices, basically, a Medicare supplement or a Medicare Advantage plan. And I like to think about it as cake, because all cake is good. It just depends on what flavor you like. My husband loves carrot. I'm not a fan. So if we're going to do a Medicare supplement, that's like designing your own cake. So your first layer of your cake, which would be your original Medicare, your second layer would be your Medigap or your Medicare supplement. And then your frosting would be your prescription drug plan. So think about it as 3 cards, 3 premiums. Or you can pick a Medicare Advantage plan. And that's like going into Fry's or Safeway and buying a cake right off the shelf. It all comes together. So Part A, Part B, and all your additional benefits. So it's 1 card, 1 premium. The other thing that's important to know is how is it structured? So original Medicare and a Medicare supplement, that's statutory. So that means nothing changes unless Congress changes it. A Medicare Advantage plan, that's regulatory. So CMS, Center for Medicaid and Medicare, is in charge of Medicare Advantage plans, and those can change every year. There's pros and cons to both choices, and it's really important to understand them. You'll see on Facebook and YouTube, there's lots of people with lots of opinions, and they'll say only MedSup or only Advantage, and it's just simply not true. You really have to analyze what your needs are and how you use healthcare to decide which is the best solution for you. The nice thing about Medicare supplements is that you can see a doctor anywhere that takes original Medicare. So you want to go to Scripps in San Diego, or you want to go to Mayo in Arizona. These are places that only accept original Medicare. And if that's where you get your healthcare, then a Medicare supplement would be the way to go, because these places don't take Advantage plans. You don't need referrals. It's predictable premiums. So you're paying less copays and less co-insurance, but you're paying a premium for that. So some people like that because they can build in their cost to their healthcare on a monthly basis, and they don't have a bunch of surprises in the middle of the year. There are some benefits that are not covered by original Medicare that you can get with a MedSup, very small. I wouldn't rely on them. MedSups are stable. Original Medicare is the boss. So you're not going to see any changes unless Congress changes something, and they don't really get along, so they don't make a lot of changes. And then when you're turning 65 or going on Medicare for the first time, you have what's called a guaranteed right, which means they can't look at your health in trying to decide if they want to take you, where later they could. Some of the disadvantages, well, it's like car insurance. You're paying for something that you might not be using. Some people are really bothered by that. They're healthy, they don't see the doctor, and they're making a premium payment every month for something that they're not actually using. You're only going to get coverage if Medicare pays. So Medicare is the boss. So if they pay, your Med Sup pays. If they do not pay, your Medicare supplement does not pay. So when we talked about the annual physical, that's a perfect example. Your first year you get it, Medicare pays, your supplement pays. The second year you do your annual physical, Medicare denies, your supplement denies. You call me, I tell you to ask the doctor to change the code to a wellness visit so it could be covered. However, there are some things that Medicare just won't cover. So I did have a client that was in the hospital for 6 months. He was in a coma. He lost a lot of weight and he needed formula because he had lost 60 pounds. Formula is absolutely not covered by Medicare. They denied it, and the supplement denied it as well because they're required to. So they had to pay out of pocket for that one cost. His bills were millions, so I'm not sure that they were really complaining, but it is important to know that Medicare is the boss. And if they say no, the answer is no. You can appeal it, but it gets complicated. Prescription drugs are not part of a Medicare supplement, so you have to buy that as well. So again, 3 cards, 3 premiums, and then social determinants of health are not included. So dental, vision, hearing, that kind of thing is not going to be included with your Medicare supplement. There used to be a ton of letters that you could choose from. There's a lot less now. We're going to talk about the most popular couple and then one that was the most popular that is no longer available. So the Plan G is like, I think, the golden ticket, sometimes people call it. So you pay the Part B deductible of $240, and then after that you have 100% coverage. If Medicare pays, your supplement pays, you don't pay any co-pays, you don't pay co-insurance. So that's very nice. Lots of people like that because it gives them the freedom, and then they only pay the $240 and they don't have to worry about coming out of pocket for anything. The N is very similar. It's a little bit less expensive, especially in rural areas, but you do have some copays. So you have a copay of $20 for doctor or $50 for ER. You have to pay the $240 deductible, and it does not cover the excess charges. So if you see a doctor that charges that extra 15%, that's on you. Possible gaps, dental, vision, hearing, and then of course you need prescription drug plan. F was everybody's favorite, and I like to talk about it because you're gonna go to a cocktail party or somewhere and someone's going to tell you that they have the best plan in the world and they don't pay anything for it ever, which is not true. But they've had it for so long, it feels true. So their Part B premium comes out of their Social Security and they don't even recognize it. Their Plan F premium comes out of their checking. They just don't really think about it. They can go anywhere that takes original Medicare and they don't have that deductible. So they really don't see any billing. So basically, it feels like they can go anywhere and it's free, which is not exactly true, but that's how it feels. When we passed Obamacare, the Plan F was phased out. So people were grandfathered in, but once 2020 came around, that was not something that you could pick if you were turning 65. It's also something that if you can make a change, you may want to, because the rates for Plan F are going up a lot. Because think about it, you're not adding new people turning 65 to the plan. So the people inside the Plan F are getting older and sicker, and you're not adding new people. So those rates are increasing. Then you're going to pick a prescription drug plan. And what we're going to talk about now is true for this year only. There's going to be lots of changes for 2025. And some of them I'll be able to talk about this summer, and some of them I will not be able to talk about until October. But we are going to see a lot of disruption. So You pick a prescription drug plan when you go on Medicare, and then you will revisit your prescription drug plan during annual enrollment. And that's because policies change, formularies change, your needs change. And if you're not on prescription drugs, some people will just not pick one, and that's not a good idea because there is a penalty for not having a Part D. So you're going to want to do that. And the structure, and again, this is for this year only, it's going to change pretty dramatically for next year. The annual deductible is $545. That applies to certain tiers depending on the plan that you pick. So some plans will have that deductible applied to every tier. Some plans will have that only applied to tier 2 or 3. So that's one of the things that you look at when you're looking at buying a Part D. Then you have this initial coverage up to $5,030. And this is so confusing to people because the government keeps score in the exact opposite way that we keep score. So if you pick up your prescription drug, you drive through CVS and you pay $45, in your mind, you paid $45. The way the government keeps score when we're looking at initial coverage is what did everybody pay for that drug? So what did the prescription drug plan pay? What did you pay? And that's how they add up the total cost for your initial coverage. So what can happen is you roll into CVS in October and all of a sudden all of your prescription prices have changed because you've entered the gap where you're paying 25% for every prescription drug. And normally you're not going to know that that happened unless you're someone like me that reads every EOB that comes in the mail, which most people don't. They just throw that away. And then you have this catastrophic coverage, which is once you hit 8,000, you have 100% coverage. What's important about the number 5,030 and 8,000 is that that's not what you paid. It's what you paid and everybody else paid for your prescriptions. So when we're in initial coverage, we have tiers and we probably have zero copay for tier 1 and maybe tier 2. And then you're going to pay either copays or percentage for 3, 4, 5. But when you hit that gap, you're going to pay 25%. And that's where people sort of freak out because they don't see it coming. It happens in line at CVS when all of a sudden their prescriptions have changed. So that was choice 1. 3 cards, 3 premiums. You have a lot of freedom, you have a lot of control, you have less social determinants of health, and you're paying whether you're using it or not. The only example I can give for my family is when my father was in the hospital at Mayo, he needed socks and we were not dressed appropriately to be at a hospital. That wasn't our plan for the day. And he was wearing flip-flops. We asked for socks and they were $100. And the nurse said to him, "Do you want them? They're $100." And he said, "I have a med sup. Yeah, I want them." And what dawned on me as a child is, oh, my dad's not even thinking about the price of his healthcare. He's just thinking about getting healthy. So that is nice with a supplement because you're paying that premium. You're not keeping score with all the copays and things, but you are paying that premium. Your second choice is a Medicare Advantage. And this choice really depends on where you live. So a Medicare Advantage plan is based on your location. So you can't compare what's available to you in Maricopa County to what's available to your sister, let's say, in Florida. So Medicare Advantage plans are based on zip code and county. And so if you live in Maricopa County, you have tons of choices. If you live in Lake Havasu, not so much. The choices aren't as good, they're not as many. And so it really can be complicated when you're talking to family because it's not consistent. It depends on where you're living, right? They're all private insurance carriers, and you can pick an HMO, a PPO, a POS, and they incorporate everything, your prescription drug plan and your A and B and additional benefits. The pros in Maricopa County, there's almost no premium for most of the plans on the market. There's an annual out-of-pocket maximum. So that means it could be like 2,500, 5,000. But once you hit that number, you're not going to be out of pocket for the rest of the year. So you're not, endangering your nest egg necessarily by picking an Advantage plan. Your prescription drug costs are included in that plan. They tend to be cheaper through an Advantage plan for a reason I'll explain in a minute. And there's lots of additional benefits. So especially in Maricopa County, you're going to get dental, vision, hearing, a gym membership, fitness benefits, all sorts of things. But what's important to understand about those benefits is those are not required to be covered. So every year when the plans come out, those additional benefits aren't necessarily guaranteed. So we can get used to those, but they're not necessarily something you're going to have forever. So you have to kind of keep that in mind. The cons, again, the plans change every year. You have to pay attention. I help people with that. I pay attention. So I'm going to call my client and say, there's big changes. Your drug isn't on the formulary for them this year. Your doctor left that plan, those kinds of things. You're going to have copays. And some of those can add up. So I have a client this last month. Her copays for last month was $500 because she's very ill. Copay, you're paying per service a lot of time for those copays, and they can add up. Hospital copayments can be large depending on the plan that you pick. And then Part B drugs. So a Part B drug is anything that's injected. If you get an injection in your eye, if you have lupus and you're doing an IV once a month, these are Part B drugs, and they are charged normally 20% up to the out-of-pocket maximum. So sometimes if you're on a Part B drug, a Medicare supplement may actually end up being cheaper depending on what your usage is. And again, you have a network of doctors. So a few things. Medicare Advantage plans are given a bucket of money, and with that money, they have to cover everything original Medicare requires them to cover. Then they need to create a plan that makes it competitive in their market with additional benefits. And then they have to use money to pay doctors to be in their network. So they can't make more than 15%. If they do, they're going to be fined. They have to stay in business. If they don't, it could be like Bright Health that lost $1 billion and closed up in many states. So it's very tricky. It's complicated math, which is why you see changes in the plans every year. They have to look at usage. They have to look at their costs. And so it's important to kind of know that because things are going to fluctuate. Right now, it's pretty competitive. I think there's going to be a lot of pressure on Medicare Advantage plans for 2025 because of some of CMS's rulings. So I do think we're going to see disruption this year. Gaps for Advantage plans. You might want to consider a hospital indemnity plan that's going to pay your hospital copays. You might want to consider a cancer plan. These are not required. You do have good coverage. These are just additional things you might want to think about adding to give you a complete coverage that looks sort of like a Medicare supplement, but is less expensive. You're still in a network though, so you have to keep track of that network. When you do an Advantage plan, you can change during annual enrollment period. So that's October 15th through December 7th. That's where you see every single annoying commercial. What's important to know about those commercials is generally a lot of the information they give is not actually legal. The problem is CMS is not in charge of the commercials, so we need some agency coordination to take care of some of this stuff. The free grocery cards, those kinds of things are generally only for people who qualify for Medicaid. I can't tell you how many people, high income people, that call me and say, how do I get the grocery card? Well, you don't, because you're not going to qualify. And then open enrollment, that's from January 1st through March 31st. And that happens, let's say you picked a plan and then in January you find out your doctor doesn't take the plan. You can make a one-time change. Or you picked a plan, but your prescription isn't in their formulary and you want to make a change. So you can make a change then. There are other SEPs that you might qualify for, and these are changing. So we're going to see some announcements around that as well. The important thing is to know you're not married to the Medicare Advantage plan. You do get opportunities to change. So what should you choose and why? I mean, I don't know. It's complicated. So that's why it's important to have an in-depth conversation. Who are your doctors? Are they actually in networks? Some people, every doctor they have is in a network. Maybe then an Advantage plan is going to work. If your most important doctor is not in any network, then maybe it's important to do a med sup because you want to keep that doctor. Do you need those extra benefits? How do you feel when you're lying awake at night? Do you worry more about money or more about freedom? Or we all have different pain points and we all have different responses to risk. And so we make different decisions. Husbands and wives often will make different decisions depending on how they feel about things and their health and that kind of thing. So I help you analyze all of your choices and then figure out what feels most comfortable for you and what choice is going to work for you, and then let you know the risks involved with that choice. So I've mentioned that there's some really big changes ahead for Medicare 2025. We are going to be seeing a new prescription payment program that CMS has created. I'm waiting for the final documents on that. I was at a conference last month and I talked to CMS and they're still creating the documents for this program that will be implemented in October, but this is going to be a big deal. I think we're going to see large increases in prescription drug plans. There's been a lot of changes, and I think we're really going to have to check formularies. It's going to be a very disruptive year when it comes to prescription drug plans. Same for Advantage plans. CMS has said that they're going to lower their payments to them. They've made some additional requirements. The big three, which is Humana, United Healthcare, and Aetna, I think are all looking at all that structure and seeing how they're going to have to make some changes to their plans. And then I think we're going to continue to see increased premiums for Medicare supplements. So if people are on Medicare supplements right now, United and Blue Cross Blue Shield just did really high percentage increases that we haven't seen in a long time. CMS made some announcements that I think are going to put more pressure on Medicare supplements for 2025. So I'm going to be doing some presentations at the end of the summer on what we can expect for these changes and sort of how to prepare for them. And then why do you use an independent broker instead of dialing 1-800 or going on Medicare's website? I understand your plans. So if you have an issue with the plan, I can actually advocate for you. I can analyze all the different plans. When you call an 800 number, you might be just calling United or Aetna. They're not going to tell you about their competitor. I'm going to help you with customer service. So like I just recently had a client on a plan who had a very rare cancer, and there's only 2 doctors in Maricopa County that treat that cancer. Both of them do not take Advantage plans. We were able to get the Advantage plan to pay for that doctor, and they're paying a $10 copay because that's what's required in their specialist copay. But those things are complicated and they're hard to do on your own. And then a 1-800 number or Medicare.gov is not going to do that kind of work for you. So I think that we provide real value. And then, of course, if you want to reach me, Cynthia Macluskie, and that's my website, my phone number. And I would love to answer questions.
So thank you so much for all of that fantastic information for sure. So I had read you a question. We have a lot of questions, so we need to get to those. But I had asked you a question that somebody had sent to us while beforehand, and her question was, I was put on Social Security disability income and then Medicare. I chose a Medicare Advantage plan due to being under 65 and unable to find a supplemental plan. If I'm currently enrolled in Medicare with an Advantage plan, should I now switch to straight Medicare with a supplement, and how can I do this? Which is clearly, I'm going to guess you're going to say, give me a call, because of the issues you just went over as to, is it better to be on an Advantage plan or traditional Medicare without really understanding formulary, doctors, diagnosis, all of those other things.
But what is important to know is so each state does it differently. So in California, if you're under 65, you are allowed to pick a Medicare supplement. But in the state of Arizona, you are not allowed to pick a Medicare supplement. When you turn 65, you get that choice one more time. You're not penalized for not being able to make that choice under 65. So if you're turning 65, that is a really good opportunity to review all of your choices and then make the decision. Some people just aren't aware that they get that second choice. So you do get that second choice. And then if you move to a different state, the rules could be different. If you picked a Medicare supplement in the state of California and you are under 65, you could be paying $400 or $500 a month. So it doesn't mean that they actually want you on their plan. They rate you based on what your usage is going to be. When you turn 65, they don't have a right to look at your health care and your usage. And so in this state, you would get a great opportunity to jump in if that makes sense for you. But we would really want to look at all the choices before you did that.
Okay. So on that, so one question was, who would pay for your services if the client elects traditional Medicare with a supplement instead of deciding to go with an Advantage plan?
So all the carriers pay me for my service, so I never charge anybody a fee for helping them, and I give lots of free advice to people. And especially the disability community, there's a lot of people with developmental disabilities that get auto-enrolled in a Medicare Advantage plan, which the state's view is that the access or the Medicaid plans network is the same as the dual plan network. So they don't see a conflict in doing this, but it's not true. There's a 10 to 15% difference in those networks. And sometimes I'll advise families to keep original Medicare and Medicaid and a prescription drug plan and not do the dual plan. And there's not really an advantage for me to give that advice, except that it's honest advice. And I don't advertise for my services. My business is built on referral. So the way you get referrals is being an honest person and giving people honest advice.
Sure. So somebody asked, you mentioned Mayo Clinic. Do you know if it's true that they changed accepting Medicare, or maybe it was Blue Cross Blue Shield that they don't accept anymore?
So Blue Cross Blue Shield is complicated. There were some issues with Blue Cross Blue Shield, not necessarily with Mayo, but with Dignity and some other carriers with other providers, which could have been Mayo, but that was more around some of the MedSup and some of the employer plans. To my knowledge, they've made up with all the providers right now. So I don't think that's a problem. What I will say about Mayo right now is they do not take Advantage plans ever. They mail out a letter to all of their patients every year reminding them of that. They're not fans of original Medicare. So if you're not a patient with Mayo before 65, they're not necessarily going to take you after 65. If you have something interesting, or if it's a department that has openings, they might take you. But like if you were looking for primary care, very unusual that Mayo would take you, even with a MedSup and original Medicare.
Okay. So then, let's see. Talked about that. Somebody said, can you please talk about the tendency of doctors to now state they're concierge doctors and require $2,000 a year in addition to what insurance and Medicare is paying? Do you know anything about that?
I do know that. I actually get a lot of referrals from concierge doctors. So concierge doctors, the problem really is that doctors are not big fans of value-based purchasing. And value-based purchasing is what you're going to see with Medicaid, what you're going to see with Medicare Advantage plans, what you're going to see with some employer plans, less employer plans, more Medicaid, Medicare Advantage plans. Original Medicare is fee for service. So providers generally prefer original Medicare fee for service, and they're not big fans of value-based purchasing. And our government seems to think that value-based purchasing is going to get us better health care for a cheaper price. And I think long-term, we're not going to actually find that to be true. And so I can tell you what one of the concierge doctors told me. 10 years ago, he was seeing patients and he didn't know them anymore because he was required to see so many every 5 minutes. And he didn't even feel like a doctor. He's like, I felt like McDonald's. Like they came in, they came out. I had no idea who they are. So he now has gone down to 1,000 clients instead of 10,000 clients. And he knows every single one of them. And he feels like he's being a good doctor. And he's making the same amount of money that he was making when he had 10,000 patients and didn't know them. So I do think this is a trend that's happening. And then it's tricky because sometimes you can pick an advantage plan that a concierge doctor has a contract with, and you use the advantage plan, plus you're paying that fee. Sometimes you do a MedSup. So it's sort of tricky. I even have people who are on ACA plans, which is here, who are using concierge doctors. And it takes some research and some help in navigating all of that. I know that patients find it frustrating when they hear that their doctor is going to concierge. But I get it. It's because we're making them see so many people in such a short amount of time. They don't really feel like they're being good doctors anymore.
Yeah, so you can have a concierge doctor, pay them whatever their annual fee is, but you can still use your insurance as long as that doctor accepts that insurance. Is that what I'm hearing?
Correct.
Yeah.
Yeah, and some concierge doctors will take any insurance, they don't care.
Mm-hmm.
Other concierge doctors are much more particular. So it's really a case by case basis on how you structure that.
Sure. So somebody said that her supplemental premium goes up every year, and she learned she can apply for another supplement so she could start with a lower premium. Are people typically applying for a new supplement every few years to save money? And is there a health screening that one has to go to qualify for that process?
Excellent question. So if you lived in California, my answer would be different because this is state to state specific. But in our state, we do not have the birthday rule. So there's a few states that do. We're not one of them. And so what that means is you can shop your Medicare supplement all you want, anytime you want, as long as you can pass underwriting. So I'll give you an example of my father and my stepmother. We shopped my father's plan. We changed him from an F to a G. He's paying substantially less money a month than my stepmother, who's 10 years younger and a female, because we could not shop her plan because she has COPD and nobody would take her. So once you pick a MedSup, it's important to think about how you do that. So a lot of times people will just go online and find the cheapest MedSup and sign up, but they don't think about things. So I like to talk about, and listen, I'll roll the dice with anybody. My risk tolerance is 0. I have clients who have a higher risk tolerance than that. But when I look at MedSups, I look at what is their market share? How long have they been in the market? What is their rating? What is their loss ratio? Because when you pick the cheapest plan, what could happen if you were unlucky is have a health issue that then doesn't allow you to change. So I have a client right now, we just put her husband on a med sup, not the same as his wife, because she picked that one herself. That one that she picked no longer does business in the state. So now she's paying more for that. Nobody can join that. And she has a health issue that won't let her out. So it gets complicated when you are looking at these things.
Okay, another question is, I'm over 65 and currently employed with healthcare benefits covering myself and my spouse. My spouse just turned 65. I want to wait to sign up for Medicare until we retire. Are we risking paying more for Medicare or Medicare supplement because of the planned increases you mentioned? Is there any reason to sign and pay for coverage that we don't need while employed?
So a few things. One, if you choose to stay on an employer plan, make sure that you talk to human resources and make sure that the employer plan is creditable for Medicare. Most employer plans are, but not all. You also need to be very careful if you're an employer that has 20 or less. Most of the plans require that you take Medicare at that time. So there are some rules around making this choice to stay on your employer plan. Once you've evaluated that, I think it makes great sense a lot of times to look at which is cheaper. And a lot of times it's cheaper to keep an employer plan. It just depends. If you have a health savings plan, it's important to know that if you enroll in Part A, you can no longer contribute to a health savings plan. So there's some really significant things to think about, intricacies, but about avoiding the cost for a med sup is going to go up every year. So signing up now versus later, I don't think is really going to save you the money. I wouldn't use that as the reason to jump on to a Medicare plan versus keeping your employer plan. And then another thing you might want to talk about with your financial person, which I am not. I'm not a lawyer or a CPA. I am an insurance person. So you might want to talk to your CPA, because if you're a high earner and you choose to wait till you retire, you can then qualify for and apply for a lower Part B premium because you're leaving your employer plan while you're applying. So there are some things to consider, but I don't think you're going to save money by just jumping on. Like, supplements are going to go up; they just are.
Okay. So somebody said with commercial insurance, copay cards help with medication extra costs, but once on Medicare, the government insurance negates that. Is there any workaround, or do you have to go directly to the manufacturer and talk to them about your low income issues?
Great question. So true what you said. There's two different programs with the coupon cards, and they're categorized differently. I actually pay for to be in a group of pharmacists that help me navigate this. So you could qualify for patient assistance at the manufacturer level. You might qualify for grants. There's other ways to look at saving money. And it doesn't even matter if it's an expensive drug. I just had a client call me. She picked up a drug and it was $120 for 90 days with her prescription benefit. But on cost plus drugs, it was $5.80 for 90 days. So I really encourage all my clients to check all these different ways, and I help them do that. And that doesn't matter, like if you're an employer plan, Medicare, whatever, it's worth taking a look at. I look at GoodRx, although they have gotten in trouble before with like selling information and things like that, but they still provide good discounts. Savings RX provides good discounts, cost plus drugs, and there's other pharmacies creating a cost plus kind of situation. And what that means is they're taking insurance and the PBMs out of that whole thing. So it's complicated, but there are definitely things that you can do about it. And I could give an entire talk on PBMs and how it affects your prescription drug cost.
Okay. So kind of following up to an answer that you gave. So it says, do I have to stop contributing to my HSA for a period prior to signing up for Medicare? Or is it that the HSA contribution is fine until the month before I retire and sign up for Medicare?
What's important to know, because that question is not detailed enough. If you're turning 65, then they don't backdate Part A. Part A starts when you turn 65. If you choose to retire at 67 and you apply for Part A and Part B, they will backdate your Part A 6 months. And so you would want to stop contributing to an HSA 6 months before you're going to retire because they're going to backdate your Part A.
Okay. Somebody has asked that they do a lot of international travel, and is it better to have a Medicare supplement plan or a Medicare Advantage plan?
So that's, first of all, I really encourage people to get travel health insurance because you can just get caught up in so many different situations, and travel health insurance is very inexpensive. Um, it really depends on the plan. So there's some Medicare Advantage plans that give you 100% coverage internationally. It's unusual, but they do. Medicare supplements, I think, will give you $50,000, but you can blow through that amount so fast. So I really always encourage people who are doing international travel to buy travel health insurance so that you're not caught off guard.
And then one last question. My boyfriend just turned 65 in late February. He has a job with insurance. He lives in Utah, but he's planning to move to Arizona next month, and he's going to have to find a new job and is hoping to get one with that covers health insurance. He signed up for Part A already, but he's holding off on the other options. How much time does he have to sign up, and what can he do during the gap between jobs?
So that's a very complicated question, believe it or not,
I do
because
believe it.
Cobra is not creditable coverage for Medicare. So he could sign up for Cobra for the 2 months while he's looking for a job. But once we're past that period, it makes me nervous. Like, so I would want to like really drill down on how he's doing it and what he's doing. The safest thing might be to start Part B. It's hard to say, but going without insurance when you're over 65 or using Cobra can have implications that are negative, and you really need to look at that.
Okay. And so just to reiterate, it doesn't matter if a person, when they call you and they have questions and they want to review, am I doing the right thing? There's no out-of-pocket expense to that person. And
No.
if they decide that they want to buy a Medicare Advantage plan, or they decide to go traditional Medicare, or they want to supplement, they still don't pay anything, and you're just compensated by all of the companies that you contract with, and it doesn't have anything to do with the individual advice that you give. Is that right?
100%.
Okay.
Exactly.
So you should feel comfortable, folks, in contacting Cynthia because it doesn't cost anything, and then she can drill down into more detail on the questions. It's the way I feel all the time when somebody asks me a question and I'm like, okay, I'm sure there are 50,000 other facts that I really need to know to answer this question, but here's kind of a general overview of that answer. But there's no cost, and it doesn't hurt Cynthia financially or otherwise, whether you decide to buy a product or you don't decide to buy a product.
No, and what I'll also add is like I so often I see people who qualify for ASRS. And if they want a Medicare Advantage plan, I'll tell them you really should stay with ASRS. And are you even aware of what they offer? And they're like, no. Well, I have that on my computer because I see enough people with that that I want to make sure that they understand their choice. And if they do that, then I don't get paid, but that's okay. because those people tend to be the people that send you a lot of referrals because they appreciate your honesty and your helpfulness.
Okay, wonderful. Well, Cynthia, I can't thank you enough. It's always lovely to see you and visit with you, but I really appreciate all this fantastic advice that you have provided today and the advice that you can provide in the future to clients and family members. So thank you so much. Thank you all for participating today. One of the questions was whether or not we will get your contact information to those who have signed up, and absolutely, we are more than happy to do that. So our office will send that information out so everybody has it in case they need to reach back out to you. So thank you all. Have a great rest of your day, whatever you're doing, and hopefully we'll see you next month for our next webinar. So thank you.
Bye, everybody.
Bye.